Welcome to another episode from the Veterinary Research Channel. Today, we're expanding on a previously discussed study, diving even deeper into the innovative endoscopic technique for removing gastric foreign bodies in dogs. This method presents a compelling, less invasive alternative to traditional surgery, refining our approach to common canine challenges. As we shared previously, our story is set in a bustling referral veterinary hospital in Paris, France. Here, a team of dedicated veterinary internists and internal medicine residents embarked on a detailed review of their case logs spanning from January 2020 to April 2023. Their mission was to identify and analyze instances where dogs underwent endoscopic foreign body retrieval using a particularly clever technique, employing a bottle liner, revisiting the challenge of gastric foreign bodies. To reiterate, gastric foreign bodies pose a significant and frequent problem in our canine patients. These ingested items exhibit remarkable diversity, ranging from relatively benign materials like plastic fragments to more hazardous objects such as stones, metallic components, and even glass shards. Efficient removal of these foreign bodies is paramount to safeguarding the health and welfare of affected dogs. The approaches to removal range from inducing emesis using medication, endoscopy, or surgical intervention. A closer look at traditional removal methods and their limitations. As we've noted, the initial strategy often involves inducing emesis through medications such as Apomorphine or Tranexamic acid. While these drugs can be effective, their success rates vary. More critically, inducing vomiting is not without inherent risks. It is contraindicated when sharp or corrosive objects have been ingested or in patients exhibiting decreased mental awareness due to the elevated risk of aspiration. Furthermore, the effectiveness of emesis induction diminishes in older animals, in those pre-medicated with certain drugs, or when the foreign body has resided in the stomach for over 24 hours. Consequently, endoscopy emerges as the subsequent logical intervention because it boasts a higher success rate. This procedure entails the utilization of specialized instruments, including grasping forceps, Roth nets, wire baskets, and loop snares, which are carefully introduced through the endoscope's operating channel to extract the foreign body. Nonetheless, even endoscopy encounters limitations. Foreign bodies with smooth surfaces or excessively large dimensions can prove challenging to grasp securely, and sharp-edged items carry the potential to inflict trauma on the delicate digestive tract mucosa during removal. Deep dive into the bottle liner technique, a refined approach. The bottle liner technique offers an ingenious solution when conventional methods are inadequate. A plastic bag, typically used as a liner for baby bottles, is strategically positioned at the distal end of the endoscope and advanced into the stomach. Forceps are then employed to carefully maneuver the foreign body into the awaiting liner. Finally, the liner, now containing the offending object, is gently extracted from the gastrointestinal tract with the aid of traction threads. Revisiting the study, aims and methodology. As previously mentioned, despite its occasional use in veterinary medicine, the bottle liner technique lacked comprehensive documentation within the existing literature. To address this gap, the study was designed with the dual purpose of providing a detailed description of the bottle liner technique and meticulously reporting its practical applications, utilization, and clinical outcomes. The study employed a retrospective case series design, encompassing 12 dogs that underwent the bottle liner technique for gastric foreign body removal between 2020 and 2023. The researchers systematically gathered comprehensive data pertaining to various aspects, including the dogs' medical histories, the specific types of foreign bodies encountered, relevant radiographic and endoscopic findings, the specific retrieval techniques employed, and any complications or adverse events observed. Detailed preparation for the procedure. Prior to commencing the procedure, informed consent was meticulously obtained from the pet owners, ensuring their understanding of the process and potential risks. The dogs were managed in accordance with contemporary veterinary standards of care, with anesthesia carefully induced and continuously monitored throughout the entire process. The preparation of the bottle liner device demands precision and attention to detail. A standard 4-ounce bottle liner is carefully fitted with 3 non-absorbable sutures strategically positioned at its opening, ensuring secure and reliable traction during the extraction process. Subsequently, the endoscope is skillfully advanced into the prepared liner, and the outer surface is lubricated to facilitate smooth and atraumatic passage through the gastrointestinal tract. Elaboration on the procedure, a step-by-step guide. The bottle liner technique involves a meticulously orchestrated sequence of steps. The bottle liner, carefully positioned over the distal end of the endoscope, is gently introduced into the digestive tract and skillfully advanced into the stomach. The inherent transparency of a liner permits easy maneuvering through the gastrointestinal tract under direct visualization. Once the liner is strategically positioned within the stomach, it is gently guided into the pyloric antrum. Subsequently, the endoscope is carefully retracted to provide a clear view of both the liner's opening and the targeted foreign body. Forceps are employed to delicately manipulate the foreign body, guiding it into the awaiting liner. Finally, with precision, the threads are gently and steadily pulled to extract the liner, now containing the foreign body, from the gastrointestinal tract. The endoscope and liner are removed simultaneously to maintain appropriate insufflation of the gastrointestinal tract and to directly visualize the successful extraction of the foreign body. Revisiting the results, an overwhelming success. The study's outcomes were truly remarkable, reinforcing the effectiveness and versatility of the bottle liner technique. In all 12 canine patients, the foreign body retrieval procedure proved unequivocally successful. Notably, the bottle liner was strategically employed as the initial retrieval method in 5 cases, carefully selected based on the inherent characteristics of the foreign bodies, whether they presented with smooth surfaces rendering them difficult to grasp or exhibited sharp edges posing a potential risk of trauma. In the remaining 7 dogs, the bottle liner served as a valuable rescue procedure, effectively salvaging situations where alternative methods had proven inadequate. The diversity of foreign bodies successfully removed using this technique was noteworthy, encompassing a wide array of items such as dog toys, fragments of plastic or rubber, stones, a ball, pipe connector, pieces of plastic balls, and even a beer cap. The duration of the procedures varied, depending on the complexity of the extraction, ranging from swift 3 minutes to a more protracted hour for particularly challenging cases. In-depth analysis of complications and outcomes. While the bottle liner technique demonstrated exceptional efficacy, it is essential to acknowledge the occurrence of minor complications in a subset of cases. Specifically, 5 dogs exhibited erosions and bleeding of the gastroesophageal sphincter. Nevertheless, the vast majority of dogs, with the exception of 2, were discharged on the same day, underscoring the minimally invasive nature of this approach. 1 dog, initially presenting with hemolytic anemia, experienced a cardiorespiratory arrest the night following the procedure, although subsequent examination revealed no evidence of gastric or esophageal perforation. Another dog presented with abdominal discomfort approximately 10 days after the procedure, but was successfully managed with appropriate medication and supportive care. Unpacking why the bottle liner technique works. The remarkable success of the bottle liner technique stems from its inherent versatility and adaptability to a wide range of clinical scenarios. It proves particularly invaluable when confronted with foreign bodies that are either inherently difficult to grasp or pose a significant risk of mucosal damage during conventional retrieval attempts. The study's findings not only corroborate but also surpass the outcomes reported in previous investigations of this technique, further solidifying its position as a valuable tool in veterinary medicine. Moreover, the bottle liner technique offers distinct advantages over traditional surgical interventions, including reduced hospitalization time, decreased risks of complications, lower overall costs, and the avoidance of postoperative constraints. It can also be strategically employed as a primary approach in cases where induced vomiting is deemed unlikely to yield successful results, or when the foreign body's characteristics render it challenging to manipulate with standard forceps or snares. Acknowledging limitations and considerations. As with any research endeavor, it is essential to acknowledge certain limitations inherent in the study's design and execution. These limitations include the retrospective nature of the data collection process and the potential for underreporting of minor complications that may have been deemed clinically insignificant. Furthermore, the researchers noted that manipulating the bottle liner can present challenges in smaller canine patients due to the restricted gastric volume. Final thoughts. A cornerstone in the veterinary toolkit. In conclusion, the study unequivocally underscores the bottle liner technique as a cornerstone in the endoscopic removal of gastric foreign bodies in dogs. Its cost-effectiveness, ease of implementation, and remarkable success rate make it an indispensable tool for veterinary practitioners. By providing a comprehensive and detailed description of the procedure and its associated outcomes, This study significantly contributes to the expanding body of knowledge surrounding minimally invasive techniques in veterinary medicine. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.